and welcome back to By Any Means Necessary. I'm your host, Melvin Thompson, the Executive Director of the Endeleo Institute, the nonprofit community development arm of Trinity United Church of Christ. We all know where Trinity is, right? 400 West 95th Street in the beautiful Washington Heights community. It is a glorious day in the neighborhood, just another fall, beautiful day. You know, I can feel the changing of the seasons. The autumn is in the air. Even though by calendar we're still in summer, you can feel that hint, right, of things changing. And it's been a minute since I've been in school, but I still feel like in September, you know, you get a fresh slate, like you're going back to something. And you know, this is just a wonderful time of the year, and you get to start, you know, kind of with a new canvas, and so we're just really excited about all the things that are going on. The farmers market is reaching the last couple of weeks. We've had some wonderful crowds lately, and just beautiful weather. This weekend is slated to be another glorious weekend, probably 78, 80-ish, like that. It's going to be wonderful. We've got some students coming out to the farmers market, which is located at where are we at? Let me show you. The farmers market is at 95th and Normal, which is right across the street from Trinity. So we're right at the corner in the parking lot across the street from the church. We're there from 8 a.m. to 1 p.m. And this week we're going to have students and some other church members from, I believe, Oakdale Covenant, right down the street in Washington Heights. So we're really excited about bringing them in, and I think there are going to be some students from the church that are going to come and learn about our garden, our farmers market, and just all the things that our young people are doing in and around the farmers market. So we're excited about that. We've got some other special guests, I believe, from the Greater Food Depository, who are going to be stopping by to kind of get the lay of the land and how we do things. So I'm excited about it. So from 8 a.m. to 1 p.m. this Saturday, 95th and Normal. Come early. It's watermelon season. Those are usually gone by 10:30ish. So get out there early. We're really you know, as we start to wrap up these last couple of weeks, the last market is Gloria, is it September 29th? Yeah, September 29th is our last market day. So we've got about 2 weeks to go, and so, you know, take advantage of it. We're doing really wonderful things. Our vendors are coming out and able to, you know, compliment the black farmers from Pembroke, Illinois. And so it's just a great cooperative economics model that we are trying to sustain on 95th Street as part of the revitalization of the corridor. And if you've heard anything that I've said on this show about the mission at Endeleo, as you know, we focus in health, education, and community development. And all of those things, those three elements, are inextricably linked. So you can't have health without being educated, and you can't do that all without involving the community. And so, you know, I'm really been really encouraged over the last several weeks, or the last couple of months actually. We've been doing these community visioning sessions at the Woodson Library, at the restored, beautiful, awe-inspiring Woodson Library that, of course, we as a community helped spearhead the restoration of. And so if you haven't been there, please do yourself a favor. Bring your family out. Come out. There's something at the library for everyone, literally. You know, from the child's section, to, you know, child care section, to a space for teenagers and youth media, older adults, our dementia-friendly aspect. of the library, and just the auditorium, and of course the Vivian Harsh collection, which is the largest collection of African American literature in the Midwest. And so we just encourage you to come out. And before I go into that, please give us a call if anything resonates with you. 312-738-1060. 312-738-1060. So I mentioned we've been having these visioning sessions, and so this past Saturday we had an outstanding session in terms of engaging the community around what they would like to see along the corridor. And one of the things that we wanted to do was have folks, we always talk about not being what you can't see. And so we had black developers and architects as part of a panel discussion, and we really got into talking about some of the opportunities, but more so the barriers to getting development done in our community. And so we got an earful of what needs to happen before development can even take place. So we got folks talking about cleanliness and trash and debris, all of those things, from people hanging out on the streets, creating unsafe conditions, and even infrastructure from a lighting standpoint. That was insufficient lighting along the 95th Street corridor. All of which I agree with. All of those issues are certainly need to be taken seriously in terms of how do we even attract the kind of development that we envision along the 95th Street corridor. And before we can start doing that, we need to address safety issues, lighting issues, and probably one of the easiest things to address is cleanliness. I think that's a personal responsibility of every citizen, and we need to make folks aware of it. Perhaps start, petitioning the city to put more garbage cans, in visible areas along 95th Street, and encourage that. I know I've already taken steps to reach out to organizations that actually specialize in coming in and doing that kind of work. I've seen actually in other communities where they have special shopping districts. I think they're known as SSAs, where there's a provision for cleaning corridors. And so I was on 87th Street in the Chatham area a couple of days ago, and I saw a number of people wearing those orange vests, walking down the street, picking up trash, sweeping up, carrying garbage cans up and down the street. And so we need to do that in the Washington Heights community. We need to establish some kind of chamber of commerce, whatever is necessary as an entity to secure that kind of what we want to see to begin cleaning the area. And again, I think you're not going to get really any pushback from the community in terms of that, and whatever the cost may be to the business owners, I'm sure there's room for negotiation. And so, before we get into our last visioning session, which is going to take place October 18th at the Woodson Library, we'll definitely have an agenda of next steps, because that fourth meeting will basically be what we heard, what we've heard over these last three visioning sessions, and we've heard a lot. And again, there are varying opinions about what should be along the corridor. But I think the consensus, and this is really great for our farmers market, because the consensus thus far is a grocery store or some element of a grocery store. In fact, one of the developers at the meeting last Saturday even suggested the idea of a cooperative grocery store and cited an example in the Logan Square community on the north side, not far from here, where a band of 35 to 40 residents came together and pooled a bit of money and found an operator who was willing to come into their community and set up a cooperative model of where the residents in the community actually have a stake and ownership piece in a grocery store, and that really resonated. It's resonated with me for quite some time. You know, you don't find a lot of cooperative. This is not a cooperative city in terms of well, that may be a play on words, but the cooperative model from an economic standpoint, they're far and few between, and I think that it's time that the 95th Street corridor, you know, seriously look into the establishment of that. And so we plan to visit. I believe it's Dill Pickle that is actually the cooperative grocery store that she referenced. I've been to the website. It looks amazing, and you know, the main thing is that it's community led, and so that is really you know, part of the vision of revitalizing the 95th Street corridor. This shouldn't come from me. It shouldn't come from Melvin. It shouldn't come from Endeleo per se. It should come from the community, and that way the buy-in is stronger when it's a community-led or community-driven aspect. And so we don't have to do everything all at one time. We're talking about practically a 4-block radius between Trinity Church and the Red Line station that really needs the sprucing up. We have a number of abandoned buildings, vacant lots, and they are just conducive to the kind of things that we're hearing complaints about from the residents who live there. And so we can take, you know, real steps in terms of changing the narrative, and I think it's going to be an inside job. I'm so frustrated by you know, thinking that we have to, you know, attract people from outside of the community to, you know, to better our situation when we have the tools to do it ourselves. And even the black developers and architects, you know, tend to, you know, migrate to communities where the opportunity is, and sometimes those communities aren't communities of color, and I get it and I understand it, but we're going to have to start looking more internally at our own problems, because you know, those are valuable people and valuable resources that have done this kind of work. And so, you know, while I certainly, you know, don't begrudge anyone from making a living wherever they can, I think that this is an untapped area in our community that we need to really, you know, claim as our own, because guess what? No one else is doing it. No one else is doing it. So if you want to call in, 312-738-1060. Wanted to talk about a little bit something that I saw, an email that came to me today, and it basically says something that was really striking, and it's something to why Endeleo is actually, you know, focused in health, education, and community development. I want you to take a look at a very illustrative graph that I have on the screen here. Nope, I'm sorry, not there. Where we on the web. Okay, so sorry about that. So got this in my email today from the Federal Reserve, and it basically states really the obvious, but it really brings home, you know, what the elements are in terms of, you know, what makes us healthy and what literally makes us sick. So if you, I mean, just look at, you know, the figure of a human, and the tagline of people get sick because of their social and physical environments, right? So right in the middle is a citizen, right? And look at all the things that help make up that person's well-being, right? Schools, quality education, grocery stores, which again is not, that's the consistent theme that we've heard in the last 3 visioning meetings. Housing, decent, affordable, safe, and healthy housing. Transportation, the ability to get from point A to point B and not have it take 3 hours to get to your employer or wherever you need to be, or to a facility of higher learning or something like that. Parks and playgrounds, places that are safe where you can get exercise. If you're not eating all that great, at least you can exercise and keep your heart healthy and do the kind of things, get some fresh air to actually get out of your housing environment and get out and get some fresh air. Although those parks need to be well lit, they need to be safe, they need to be walkable, and we've talked about walkable areas. And then jobs, of course, a good, living wage, where there's a future, and not necessarily a long-term 40-year career like we used to see just decades ago, but perhaps a series of projects that you work on. What's interesting about the current mayor stepping down is that there's legislation about limiting that position to 2 terms, and when you think about that, there's something to that, because our jobs seem to be going in that same kind of direction where you don't keep a position forever. Rather, there are projects that come, you do the project, and then that project's over, and then you go on to the next one. And we'll be talking about that a little bit more, but that's one of the things that we talk to our students in our college and career readiness program, that you may not be entering the job market when you graduate from college or when you graduate from high school and do certain vocations. You may not be there for a lifetime. You may do a series of projects over the course of your life and work 10 or 15 different places. And so that's the 21st century because of the cost of healthcare and other things, that it's just a changing of the guard. And then finally, schools. I mean, a quality education is critical. There's plenty of evidence, and in fact, I think I received an email today telling me something I've heard time and time again, that folks that are educated actually live longer. And so, I wanted to show you that to kind of give you the context of when we talk about health. So, it's great to have a farmer's market. It's great to eat healthy and have healthy fruits and vegetables, in your household. But look at all the other things that are involved in creating a true quality of life. I mean, a grocery store, that sells quality foods, schools, jobs, all of those things go together. And so, it got me to thinking today that, we really need a complete paradigm shift in terms of, what we do in all those areas. I think, as an organization, Endeleo is starting to think more about systemic change as opposed to programming. Programming is wonderful, but if we're not literally changing the landscape in education, changing the landscape in development, changing the landscape in the health system, then I think we're not genuinely moving the needle in our community. And I think systemic change is a more challenging goal, but at the same time more satisfying, because from a policy and advocacy standpoint, we can affect things a lot more than just servicing the community with programming. And it's a shift, but I think the work that we've been doing, let me just say, we're doing some work with the University of Illinois at Chicago around pharmacy deserts. So as you know, we've seen the closure of a number of pharmacies, Walgreens on the south side and CVS stores on the west side. Not surprisingly, in low income, mostly minority areas. And so rather than scream and complain about it, we've been working with UIC in terms of what are the policies or lack of policies that are in place to either prevent those kind of things from happening in the future, just because a company decides we need to manage our profits better, so the communities are going to suffer because of that. What stopgaps can we put in place to make sure that that doesn't happen? And then, are there opportunities to create our own independent pharmacies or set up delivery services where we can put folks to work and actually work with the major pharmacy stores that are in our communities, that are still left in our communities, and just engage that way. And I think that's a perfect example of actually trying to change the landscape of delivery, because medication is critical in our community. We'd like to see a lessening of the dependence on medication through eating healthy foods, healthy fruits and vegetables. But for now, there's such a great dependence in our community, and adherence to medication, for African Americans has always been a challenge. And so, if you've got a pharmacy in your community, that doesn't automatically translate into folks actually going to the store, getting their medication and actually taking it. So when you take away, the option or the amenity of having a pharmacy in your community and force folks to go, miles out of their community, then you're just adding to the problem. And so, from a systems perspective, we need to, put some, fail-safe, opportunities in place that ensure that folks don't have that excuse or that inconvenience. I mean, we've got folks that are differently abled in our community that have no way of getting on a bus or, having, the opportunity to, travel outside of their community. And so a delivery system is quite possible. Maybe something with cell phones, where some kind of Uber service to make sure that these medications, land in the right place. And so, again, it's really about a paradigm shift. In the last few minutes, I want to talk about, what I do and what I've done over the last probably 20 years, and that's just drive around to communities that are prosperous or on the climb, where you can see that they're climbing to a new place. I mean, there are areas, outside of our community that I've seen that, 5 years ago, 10 years ago, weren't really, not much activity, not much development at all. And now those same communities, I mean, there are cranes and, construction going on everywhere. And so, if you juxtapose that to our community, you rarely see a development or a new home being built on the south side in a community. Rarely. And if you do, you don't see a continuum of that going on. Like, you see that, and then a condominium building is built, and then storefronts and all of those things. That there isn't that chain of development that I see in these other areas. And again, that is a systemic issue that we need to address, because it's not good enough to put one thing in a community and expect that to be the catalyst for change, because it just doesn't happen. It's a different makeup in our community, and I'm recognizing that, and it's just glaring. And so I think this is the first time that I've actually really articulated it to some degree, that we need a complete systemic and collective kind of mindset to change our communities comprehensively. And I think that's what's come out of these visioning sessions, that we can't settle for just a grocery store and say, oh, okay, that's a victory. We have to put that in context and make sure that there's a next thing. So if we're going block by block, that we know there's an end game to what we're doing, and that there's a path to this, because standalone developments, even a beautiful library, isn't enough to rest on your laurels and say, okay, that's it. And so we really, over the next several months, we're going to be focusing on systemic change and less of the programmatic areas of what we do at Endeleo. And I hope that this resonates with the community, because I think ultimately we'll start seeing our neighborhoods, and I'm not just talking about Washington Heights, but I'm talking about Calumet Heights and South Shore, and all of these different communities, Auburn Gresham and Roseland and West Pullman, and all of these areas. And I think collectively, when we look at things, and I'll be reaching out to community leaders in all those different areas, and you're not going to get everybody to jump on board, but I think the people who see the vision and see that doing things in silos in just one community won't be the kind of sea change that we'll have in our community. So it begins with stuff like farmers markets, and then it morphs into urban farm systems, and the delivery of farming products from our own farms, delivered from our own hands. So the farmers market is just the precursor for a whole new model that we've got, and I'll be sharing that over the next couple of weeks in terms of where we go from here. Because again, as wonderful as a farmers market is, it's not the end game, because 3 months out of the year is not sufficient. We don't live 3 months out of the year, and so we need to do something that's a lot more sustainable. So join me next week. Please join us this Saturday at 95th and Normal for By Any Greens Necessary. Again, there's a lot going on, and what you will see at the farmers market is just a microcosm of what we want to see throughout our communities. So I'm Melvin Thompson, Executive Director of the Endeleo Institute. By any greens necessary, let's get it done, and we'll see you this Saturday, and we'll see you next week. Thank you.